Okay, we are recording. All right, so tonight we're just talking about surgery qualifications for foster kittens mostly, but cats as well. Generally speaking, we have issues more with kittens not qualifying than we do with adults, but some of the same issues still apply. And we have 3 topics to discuss that I mentioned in the email. One of them is this term body condition score, which we'll talk about. The other is weight qualifications, so what weight they need to be and what kind of weight trends they need to be on. And the final one is about illnesses, so what illnesses are okay to come in for surgery and what ones we would want to postpone for. So I'm going to do some of the basic just information, and then Dr. Brown's going to help me with some of the more complicated stuff. So like I said, if you have any questions along the way, feel free to put it in the chat or unmute yourself, raise your hand, however you want to do it is fine with me. So body condition score, this is a new term to a lot of you guys, I think. And so we wanted to explain it a little bit. It is in the new Foster manual release. You'll see that term referenced in regards to surgery, and there's a link to a chart. And so I'm going to share that chart with you guys right now. All right, can you guys see that? Okay, so basically, this chart gives you some nice little text and images for how to tell what a body condition the cat is. So 1 would be like really skinny, and all the way down to 9, which would be like real fat. But for our purposes here, what we want you guys to know is that they need to be at least 3.5 or above in order for our vets to feel comfortable doing surgery on them, so that they're, correct me if I'm wrong here, Dr. Brown, but the idea is that they would have some fat on them to be able to recover better from surgery, not be too skinny.
Yeah, I mean, if you want the technical stuff, some of the drugs that we use are actually redistribute into the fat, and they need that in order to recover completely. So if they don't have any fat layer, they actually don't recover well from anesthesia. So it is an important feature.
Thank you. Yeah. And how you can tell this, I think probably the easiest way is to feel the kitten, especially when you're dealing with like long-haired kittens. You might look at your long-haired kitten and be like, oh, he looks fine, right? But if you're really feeling in on those ribs, like you shouldn't be able to see or feel those ribs easily. You want the kitten to have a little bit of meat, a little bit of fat on there. They shouldn't be skinny. And I know it's getting pretty technical for a lot of you, like, okay, what 3.5 versus 4? But you do want to have some fat covering on there, so you're just feeling around. And feel your kittens all the time so you can get a better idea about this, not just when they're coming in for surgery, but when your kittens get home, feel them. Feel that, try to get a better idea of what that feels like normally. So when you do it for surgery, you're already familiar with it.
Probably the biggest one that I find are kittens that you can feel the hip bones really well. That's probably way too skinny. You shouldn't be able to feel those hip bones very well. I mean, I'll rate them a 4 if you can feel the ribs, but you don't feel those hip bones. But once you start feeling those hip bones, that's pretty darn skinny.
Okay, I'm gonna stop sharing this little chart here unless anybody has any questions on it. Okay, so we want chubby kittens coming in for surgery. Okay, so then we want to talk about weight, right? So these kind of go hand in hand. Generally, if you've got a little skinny kitten, they're not going to weigh very much, but that's not always the case. And most importantly, we just reduce our weight requirements to that 1.5 pound. It used to be 2 pounds, but for those 1.5 to 2 pounder kittens, we really want to make sure that those kittens are really sturdy. So they should be like chunky, fat, healthy kittens. If they're coming in for surgery under 2 pounds, they should really have that good BCS that we're looking for. And then they should be on an upward weight trend. So that means, as you guys all know, we are asking you guys to weigh your kittens daily. So you should have a good idea of where their weight is going. If they've been dealing with any weight loss or illness, something that's causing them to not want to eat well, or if they've lost any weight, or they're just stagnating, we don't want them to come in for spay neuter right then. We want to give them a chance to really be on an upward trend before they come in. Any more on that, Dr. Brown?
No, I mean, I guess it's just that it's especially important for those less than 2-pounders, the 1.5 to 2-pounders, because that's really where we're looking. But some of the medications that we use, it's really important that they're eating well and that they're gaining for those medications to be good and not be harmful, especially the pain medications that we're using. So if they're not eating well for you, some of those pain medications can be really damaging. So we want to make sure that they're eating well and gaining and overall hearty for that to be successful.
This is a good time to remind you about those foster drop-off forms that you fill out before surgery. There's a little section now in there where you record the latest 3 weights. And that's real important so that our doctors know that you are tracking that and that that is the trend, and then they can feel comfortable moving forward with the surgery.
Yeah, and that absolutely gets transferred onto our surgical papers, and we're looking at that in the morning to make sure that they're on the weight gain and doing well before we do surgery.
Any questions on weight or weight trends? The last topic we're going to talk about is illness. So what kind of illnesses would disqualify them from surgery, or what kind of things are okay to come in. And we're going to talk about 3 different common things. So you guys are all familiar with upper respiratory infections, the associated calicivirus, and then diarrhea, right? We always have kittens with diarrhea. So for upper respiratory infections, you can see a variety of symptoms. You could see just some sneezing with some clear nasal discharge. You might get some goopy or like colored nasal discharge. You might get some conjunctivitis where it starts getting red or swollen. And we really want these kittens to be healthy coming in. So ideally, they don't have any upper respiratory symptoms at all. For the 1.5 to 2 pounders, definitely no URI symptoms. We don't want them sneezing. We don't want them having any sort of discharge coming from anywhere, because again, that range of kitten is just not quite as sturdy. We want them to really, really be hardy and healthy. For the over 2 pounders, there can be a little bit of a gray area. If you're just seeing a little bit of sneezing, maybe just a little clear discharge, sometimes they can pass through. But I think Dr. Brown has some more info on this that she might want to share with us.
Yeah, I'm sure a lot of you have experienced where you're like, well, they're just sneezing occasionally, and then they come in and we take a look at them and we're like, no. And that might be because we're listening to their lungs and we're hearing more congestion than you're actually hearing audibly. And we may say, that's not okay for surgery. When we do a space surgery, we're actually putting a breathing tube into them so that we can put them on a gas anesthesia machine. If that tube gets clogged with thick secretions from their lungs, they can't breathe. So it's really important that these kitties are as healthy as possible. And a few little sneezes is fine. If we're not hearing a lot of congestion when we're listening to their lungs, we may pass them through. But if you think it's just a couple sneezes and you bring them in and we say, no, it's not okay, it's probably because we're hearing some congestion that you're not able to hear, or we're seeing some other symptoms that you're not seeing. And we may not even put them on medications, but we just want them to go home and get a little bit better before we do that surgery. We want this to be successful, and we don't want to have any emergencies during that process. So we're really looking out for all those physical aspects on these kittens. But the best thing you can do is, if you do see some sneezing and it's pretty frequent, even if it's clear, I would probably be talking to Mary and seeing, do we need to postpone this for a little while? Because even a few days can make a difference in these kittens. I'd rather they be delayed a few days than for them to come in and for us to, well, I mean, we can always, we're always a second check. So if you guys come in, bring the kittens in and we say, no, we need to go back, just realize that that can happen. You know, we're trying to make this as successful as possible, and we want to make sure that your kittens stay healthy. We wouldn't turn them away unless we felt there was a real need for that. But if you're able to screen some of those kittens and notify us ahead of time, that really helps, because then we can schedule other cats that need that surgery and not have that surgery time be less cats that we could have been doing other cats, if that makes sense.
Yeah, thank you. The other thing would be if they're on medication for upper respiratory, we would want to wait till they're done with those medications for them to come in.
Right, yeah. Eye medications are okay usually, but not like oral antibiotics.
Yeah, and that was a part of the upper respiratory is conjunctivitis. So if they get an eye infection and it's, you know, just tobramycin, something basic, they can usually do surgery with that. That's not going to affect it, right? Yeah.
Right. I saw that Renee put in the chat there that asking about 1.5 pounds versus 2 pounds. You know, all the weights are fairly arbitrary. It's just a matter of how comfortable we feel and the level of equipment that we have to monitor these kittens. So the more ability we get to monitor and we get to know how they react under anesthesia and how much ability we have to keep them warm after anesthesia and to monitor them after the process, the more comfortable we become with smaller kittens. Really, when I came into this industry 7 years ago, no one would touch a kitten below 2.5 pounds. And then it became 2 pounds. Right. Yeah. Susan Callahan was saying 2.25. Right. So it's gradually come down as the industry. This is a very, very new industry to do kittens this young. I mean, when I graduated, it was 6 months and you didn't do anything younger than that. So it's very new to be doing kittens this tiny. And it gradually gets better as we get better equipment to monitor them, as we get better methods to keep them warm, and to better medications, better anesthetic drugs. All of it makes a difference. And so all of those new advances makes it more safe for us to do those tiny kittens and to get them adopted sooner. I mean, that's our objective here. Let's get them adopted sooner. We know that socialization age is young. So if we can get them in their homes where they can be socialized by their new owners, great. And then we'll get you foster some more kittens to take care of. That would be awesome too.
Yeah, essentially that is a big part of it, is that the motivation behind it is that we can help more kittens if we can get them adopted sooner.
Absolutely.
Okay, so upper respiratory conjunctivitis, calicivirus is another one we're going to talk about. That one's pretty much a no-go. They've got calicivirus, not coming in. And I know that one could be kind of hard for you guys to detect, so it's a good time to talk about what it looks like. It can show up in a lot of different forms. Sometimes you might see your kitten limping, and that's because they have pain in their joints related to calicivirus. Not necessarily, but it can be a sign of it. And then you might look in their mouth, on their tongue, or maybe like this part of their nose, between their lip and their nose, they might have sores either on their tongue or in that area. They would be red and they would look painful. Those are calicivirus ulcers. And then the other symptom would be a high fever. So those things tend to go all hand in hand, or you might see one first and then the others come later. But we would want all those ulcers to be healed and them not to have a fever and, none of those signs in order to be cleared for surgery.
And yeah, the main reason for that is that it stays around in the environment much longer than herpes virus does. So it's a lot harder to control when we have a lot of cats around for surgery. So we don't want to be mixing those kittens with our other cats and for the potential for that virus to spread.
Yeah, and as you guys may know, with Claycy virus and those ulcers, they often don't eat very well either. So, you don't want, your kitten's likely going to not be eating very well, might be on some pain medication, and not a good time to be coming in and getting surgery.
Right.
So good reminder to look in your kitten's mouths. I know that's not the easiest thing to do, but it's good to practice, see what's going on in there. Any questions on Claycy virus? Okay. The last one we're going to talk about is diarrhea. So this one's kind of like there's some gray area, but you guys have all seen the diarrhea chart. It goes from 1 to 7. 1 would be like a hard, sort of constipated stool, and then you would have like 3 to 4 is like normal, and then a 5 you're starting to get loose stool, and then a 6 to 7 we're talking about diarrhea. So we don't want kittens coming in that are at that 6 to 7 stage. More if they're in that stage, more than likely they're going to be on some medication for that. You're going to maybe bringing in a stool sample if that's not working. We're going to be dealing with you and helping you get these kittens healthy. And if you have a surgery date scheduled, we'd want to postpone that if they're still dealing with some loose stool. If it's just like a little bit of a slightly loose 5, maybe they had a little bit of loose stool here and there, maybe you switched foods up, maybe you put them on some Fortiflora and it's getting better, like that's not a big deal. But if we're looking at some pretty severe diarrhea, more than likely we're also looking at inappetence, not eating, and weight loss, and all of that combined, and that kitten's not feeling well. Dr. Brown, you have?
Yeah, some of those diarrheas we've been working with the kittens too, and we say, no, we've seen these kittens and we're okay with going ahead with surgery. And sometimes that's, we've seen them recently and we're like, no, they're a good weight. We think this is going to be something that's going to clear up pretty soon, and we'll go ahead and do it. But those are going to be probably your more 2.5 pound kittens or so that are a little more hardy. This isn't going to be your 2.25 to 1.5 pound kittens. Those ones we're going to be a little bit more concerned about. Diarrhea does cause dehydration, and we don't want to have any of those complications with our anesthesia process and surgery.
Okay, any questions about diarrhea?
You make it sound so fun, Mary.
I know, we have to, otherwise it's horrible.
And I can put along with that, vomiting, don't try that one. Don't even bring that kitten in. We need to do something for that kitten. So
maybe bring it in, but for an appointment instead.
Yeah.
I have a question, quick question.
Yeah.
This is Gary. On the diarrhea, how many days before scheduled surgery, if we're seeing diarrhea, do we call and say, do I remove my kitten?
Yeah, that's a good question. I mean, I think that applies to a lot of this stuff. Like, when do I call, and like how soon before? And I think it's really important in all those cases that you're talking to your mentor. So, just like normal, when you see diarrhea, when you see anything upper respiratory, any illness at all, you're gonna let your mentor know, and they can advise you on whether or not we're gonna start meds, whether or not we're gonna just monitor, and they can also help advise you on whether or not that means they'll be need to postpone surgery. I would say, if you wake up in the morning to bring them into surgery and there's just a little bit of loose stool in the litter box and otherwise they've been fine, I'm not going to worry about it. But if this is like it's a few days before surgery and suddenly they're having pretty bad diarrhea, yeah, let us know, and we'll get that rescheduled. Good question. Thank you.
I guess I kind of had a question about the body condition, just because when we're talking surgery, I'm gonna assume dental because anesthesia is involved there too, and I'm thinking about having some adults that I've had that have come in for dentals, like Hermie, who had probably the worst body condition score I've ever seen. So just, case by case? And I don't want to get us into the weeds. I'm just kind of curious.
Yeah, especially when we get into adults, it can be case by case, because when they have a low body condition score as an adult, especially for a dental type of procedure, it could be because they're not eating well because their teeth are bad. So we're trying to say, okay, let's get the teeth out, and maybe they'll start eating better, and maybe we'll have better luck with getting their body weight up. So sometimes it's a matter of that. The other thing that you start talking about with dentals is we had them on an IV catheter and fluids during the dental. So it's a little bit different than when we're doing a spay or neuter. So we're actually helping those drugs along. We're making sure their blood pressure is staying elevated. There are things that are involved in that dental procedure and more things that we're monitoring because it's a much longer procedure for an adult than we would be on this spay procedure. So yes, sometimes we'll do lower body condition score adults in those kind of procedures because we know what all we're doing with the anesthesia, and we feel like it's the best thing to make sure that we're actually doing everything medically we can to make sure that cat's going to eat. Same thing for some spays in adult cats. They could be a low body condition score because they've been so concerned about I'm in heat and I need to get bred that sometimes just doing the anesthesia and getting that hormone drive under control can actually increase their body condition score afterwards. So it depends on the situation with adults. And
Okay,
some of those adults, we will also put in an IV catheter. If we feel they're really skinny, but we really want to do the surgery for some reason on the spay or neuter, we might put in an IV catheter. We might, do some other things to make sure the surgery is a little bit more safe for them.
Awesome. Thank you for the clarification. I really appreciate it.
Yeah, absolutely.
Yeah, I would say generally we're probably mostly talking about kittens here because adults, it's pretty rare that adults get rejected from surgery.
Yeah, mostly for URI type of symptoms.
Yeah.
Or if, we wouldn't normally for spays and neuters have issues where we're concerned about, if they're dehydrated, something like that, we may want to do some additional blood work first before we would do that. Or if they've had episode of not eating, which is really common in those adult cats. We do give some medications during the anesthesia process where it's really important that they've been eating to be able to assimilate that drug. So a cat that's not been eating regularly and has lost, an adult cat that's not been eating regularly and has lost quite a bit of weight, I'm talking like a half a pound, I'd be a little more concerned about that anesthesia process and be starting to think, do we need to wait a few days and investigate this versus, should we go ahead and get this done because the cat's already pre-adopted and we want to get it in its home because I think it'll do better there than in a kennel here. So that would be what we're looking for in adults more.
Great, thank you.
I
did want to mention that if you guys foster socialization kittens, that generally speaking, you don't have to worry about that when it comes to surgery qualifications. They don't need to be like fully socialized in order to come in for surgery. It's actually sometimes better that we get them done sooner when we have the space so we can fill those spots. The important things there though is that, they're not on bite quarantine and that they are able to at least, be handled relatively easily, which hopefully we're not sending you a kitten home who you can't handle at all. But, we'd want to get them at least into those basic stages where they're going to be safe to handle.
It does help though, when you put some notes on the paperwork that you bring in that says, be careful, likes to bolt, things like that, that I've seen people put on their paperwork on these socialization kittens. That does help us because we'll open that carrier a lot more carefully if we know they're going to bolt. I will actually sit there and put the kennel up on a table and stare at it for a few minutes and make sure I can tell what the kitten's going to do before I open that door. And sometimes we will decide to sedate before we even handle that kitten. So it's really helpful when you put some notes on there on how the kitten's reacting at home so that we can get a good idea of how we want to handle it at the hospital.
So general idea here is, you know, you guys are our eyes and our ears. You know these kittens better than we do. You know, we just want you to have more expertise in knowing what to look for and communicating that to us as best as possible.
We had one question from Rebecca about Froggy and her pelvic injury. Yes, we do want her pelvic injury to resolve before we do surgery. And what we'll be planning to do is to do x-rays at the time we do surgery. So we're waiting for that 4-week period before we go forward with that.
Yeah, there's always going to be some weird cases where it'll be slightly different than like other weird exceptions, but generally speaking, we'll be in contact about that.
And always, you know, if you have questions about maybe your kitten was rejected for surgery and you have questions about that, go ahead and ask Mary. She'll email me and I'll send a detailed information on why we actually rejected it. I mean, it could be that our veterinary assistant calls you up and says, yeah, they didn't weigh enough, but that may not be the whole answer. You know, the veterinarians don't just say, yeah, no, we're not doing that one. And we write a couple notes, but the whole answer may be a little bit more involved than that. And I would be happy to, you know, expand on that if that helps you learn for the next set of kittens.
And don't feel bad if sometimes you still, you know, miss something. I think what happens sometimes too is kittens like on the way to the shelter like start showing more symptoms than they did in their home. Like, oh, they were just sneezing and now the stress of getting in the car and going to the shelter, they're snotting everywhere. So Absolutely. What are you gonna do? You know?
Yeah. All the time we'll see cats that on the adoption floor that the shelter associate says, no, they're sneezing green goo. And then I go to look at them and they have a little bit of clear discharge. And I'm like, there's no green goo. So, you know, cats change minute to minute. So don't be sad if you miss some, you know, you think, oh no, I missed this and I still brought it in and it's okay. You know, really seriously, we might pick up on things that weren't even there before.
Yeah, and we're just trying to reduce the number of surgeries that get rejected because it's not good for you guys. It's not good for us. It's, you know, we want to get these kittens healthy and home, and we don't want you to have to make extra trips to the shelter. So, you know, the better we can get you guys trained on all this, you know, I think it works out better for everybody.
Yeah, the last thing I'll mention is that if for some reason you've brought the kitten in to us for an appointment the day or two before, please mention to us that you have surgery scheduled in a couple of days. Because that sometimes we don't actually look at the surgery schedule in conjunction with the kitten and we don't know when your surgery is scheduled. So if you came in on a Tuesday and you say, oh yeah, by the way, I'm supposed to come in for surgery on Thursday, we may say, oh no, you need to wait on that. So if you could please just alert us when you have surgery coming up soon, that really helps us. We don't always know that information right off the top of our heads. So just please let us know if surgery is coming up.
That's a good point. Yeah, I think we have a lot of people involved in the systems and setting up the vet appointments and you know, who's scheduling the surgery. So it's not always the same person.
Yeah. And when you see 15 cats a day for surgery, it's like, I don't remember what's on Thursday. So.
Did anybody have any general questions? I think that was all of our topics for tonight, but we have Dr. Brown.
I have one.
So, yeah.
I have one about, we had some helpline questions recently about someone who was scheduled to bring their kitten in and needed to talk to somebody about that. I can't remember what the issue was. I think it was Vian Lang had an issue with a cat. Yeah, she's there. And she called and left a message on the helpline, but I don't know how quick that turnaround is for getting access to somebody, you know, to the right person.
Yeah, that's a good question. So when you call, I think Sandy knows a lot about this because she works in that part of our shelter, but for those of you who don't, when you call the shelter right now, it goes through our helpline system. So it makes a ticket in this like software, and your voicemail gets loaded up to there, and then somebody checks that, and then they call you back. So it's a little bit complicated, but so anytime you call the front desk, that's what happens. And generally speaking, it's a staff member or sometimes an experienced volunteer who's checking those messages and calling people back. And that's usually between the hours of like noon and 7, I think, daily. So it's a little bit later in the morning. But I think, correct me if I'm wrong, Sandy, I'm trying to understand. The idea would be that a staff member would call them back and find out what's going on and chat with the hospital staff to see if it's still a good idea for that cat to come in. It's also fine to email the foster department, although it's good to know that on certain days, that email is only checked maybe once or twice a day and isn't checked throughout the day. So like on my weekends, on Sunday and Monday, Hannah might check it in the morning and in the evening, but she might be clocked out by like 2 or 3. So the front desk is usually a good option there.
So that's the first choice, is to leave a message with the front desk if they don't pick up.
Yeah, and if it's the next day, I would say do both. Leave a message and email the foster department just to cover your bases.
Okay. Thank
But
you.
again, hopefully we're catching these things beforehand. I mean, things come up obviously, but ideally, like if surgery's on Thursday and something's coming up on a Monday or Tuesday, go ahead and let us know. Email the foster department, let us know right then so we can make some plans.
Mary, Stephanie asked, could we add a line to the drop-off form to indicate if a surgery is scheduled? Meaning, I think it's if they're coming in for an appointment, maybe?
Right, because the drop-off form is for both surgeries and appointments. So I know not a lot of people use it for the appointments, but it is supposed to be used for that too. So yes, we could alter the drop-off form to say, I think it might get a little confusing if we're using it for both, but I think I can make that work. Yeah, I can look into that. These are all good questions. Anybody have any others? Okay, well, if you do think of anything, Tiffany, do you have one?
So I guess my only, and I know these are all like kind of like based on my experience, but like, so for Khaleesi ulcers, I guess it's the very tail end and they're almost healed. You're not seeing anything else, is that still a call and delay it, or?
The only reason I would probably be okay with it would be if the ulcer was not active. So it's not red and open. It's more of a little scar tissue on their tongue.
Okay.
Then I'm fine with that. But if it's red and open, I would probably decline.
Okay, that's what I was thinking about, because I had some kittens and they were well healing, but they were still, you could still see where they were. So, okay, that totally explains it. Thank you.
And it's not so much as some of these kittens will be feeling really well at that point and doing great. And you think, wow, this definitely could go through surgery. It's more of the contagiousness of the virus that we don't want to infect. I mean, if we see that, we're going to have to break down all of our equipment and clean it and make sure the next cat doesn't contract the virus. So it's more of a protecting other cats at that point, because I know kittens that are bouncing off the wall and yet they still have lesions on their tongue. And we don't want to spread that to the other cats that are there.
Awesome. Thank you.
Uh-huh.
Okay. Well, unless there are any other questions, we'll go ahead and call it a night, and I'll send out this recording to the group so that everybody can watch it. And I'll also make it available on our in our Google Drive. So, if you're like, hey, I want to touch, refresh my memory on that, you can go watch it again. Well, thank you everybody for coming. Really appreciate it. And have a lovely night.
Thank you.
Thank you.